Okay, so I was a little confused on the med chart. So normally if I were in a setting that allowed me to administer morphine, I would be administering morphine for Mr. Dubois' pain. I don't have the supplies or any remote supplies that look like morphine, so I'm just going to make a video explaining how I would administer and draw up morphine. So morphine needs to be diluted in sterile water. So I would first, doing all of my med checks in mind, I would start by doing my first med check with the morphine, pulling out the morphine and reading the expiration date, and also doing some dosage calculation to find the amount that I would need to draw up. So Mr. Dubois is called for 2 milligrams of morphine. So doing some calculations per the bottle, and just me remembering some dosage calculation from last term, I would draw up 0.2 milliliters of morphine. Now, before I do that, I would scrub the top and get out a 1 milliliter, I think, or 3 milliliter syringe, whatever's available, and scrub the top of the morphine and draw up 0.2 milliliters. Now, morphine does need to be diluted in sterile water. So looking in my drug book, it needs to be diluted in 5 milliliters of sterile water. So I would pull out the sterile water bottle, and I would scrub the top, reading the expiration date, doing all of my checks in mind, and draw up 5 milliliters of sterile water with a separate syringe. Secondly, they need to be diluted together. So I would take up my syringe that has my morphine in it with my syringe that has the sterile water, and taking off I would just insert the needle in there and put the morphine in with the sterile water. So after doing that, I would take a label, and I would make a label for my syringe with the name, the amount of morphine, as well as the expiration date on the morphine bottle, and with the sterile water too. So the sterile water, how much, and then the expiration date on the sterile water, and I would put that on my syringe so I knew exactly what I had. So after doing the second check with my prepared syringe, I would go into the patient's room, and I would swipe in, and I would do my third check with my morphine and sterile water syringe. And before you administer the morphine, you want to scrub the the cap of the patient's IV line, and you want to flush with 5 milliliters of normal saline, just a regular flush. And you want to push that over 5 minutes, I believe. Secondly, you want to administer the morphine over 5 minutes, and then you would flush. You flush with 5 milliliters after the fact, over 5 minutes as well, just to make sure that the residual leftover morphine that's in the line isn't getting pushed too fast to the patient. And the normal safe dose for morphine is 2 to 15. So the max is 15 milligrams. You don't want to give anything over 15 milligrams of morphine. It's fatal. So I wish that I was able to do the steps with a normal syringe, but this is what I can do. Okay.